Hello and welcome to episode 111 on the Healthy Runner podcast, where we help you get stronger, run faster, and become a lifelong injury-free runner. I'm Dr. Duane Scotti. I'm a runner. I'm a physical therapist. I'm the founder, owner, and creator of Spark Healthy Runner, also a coach there. And I'm super excited to share with you 5 mistakes that you're probably making to get rid of your knee pain. So we got a knee here for those watching the video version of this, and I'm a runner. So we got runner's knee right here. See what I did with that? In this episode, I'm going to share with you all that I have learned about this condition through my experience of being a sports physical therapist for the last 19 years, who specializes in orthopedics and running. I actually did my dissertation work for my PhD on patellofemoral pain syndrome, which is runner's knee. So I am super excited to be able to share this with you today during this chat, because this is a common mistake that I see a lot in a lot of runners, and it's a common reason why runners reach out to us when they need some help and they're struggling with an injury. And it's a common problem that runners who join our Healthy Runner Facebook group kind of report. So this is going to be super helpful for you if you ever get achiness in your knees. You get knee pain when you do squats, you get knee pain when you go up and down stairs, when you sit for a long period of time at your kind of desk, if you have an office job or you're on your computer all day, this is going to be for you. So for those of you who are new to our community, thank you so much, first off, for being a part of our virtual community of runners, whether you're watching on our Healthy Runner Facebook group or on our Spark Your Training YouTube channel, or if you're listening on the podcast and you're crushing your run right now. So for those of you who really don't know much about my kind of backstory, I guess I'll share that with you first. Is personally, I went from being a new adult onset runner when I was 31, who was really constantly getting injured, even though I was a sports physical therapist for my whole career. And I really got to a point where I finally overcame the injury cycle, and I'm able to run 8 to 10 races per year in my 40s. And most importantly, I'm able to get out there consistently to lace up my shoes and be able to get in those mental clearing runs that we all need now more than ever. So for example, I was able to get out there this morning and crush, some 5 miles and felt good about it, even though it was super cold out here in Connecticut this morning. But we are on the upward trend, and we're looking to longer days that aren't so dark and warming up. But the reason I run, honestly, is to show up better as a husband, father, business owner, and for you guys, my running community. So if you guys are catching this replay of this video, whether or not it's in Facebook or on YouTube, can you guys do me a favor and just type in replay? I know a lot of people aren't going to be able to catch this live. So I want to know, if you did catch it on the replay, that'd be helpful for me to know. So just type in replay for catching this on the replay. And as we move along with this training, even if you're watching the replay, drop in any of your questions into the comment box and I will answer them. And there's definitely going to be a couple of references that I'm going to be pointing you toward that's going to be super helpful for you if you're interested in this topic. The first is really our ultimate guide to crushing your miles without knee pain. So we have a free ebook on this, and I'm going to actually reference that a little bit. I'll show you a little bit of what that looks like. And if you want that download, just type in download into the comment box and I'll shoot it over to you. The other helpful episodes are going to be episode 33, going back in the archives there to where I talked about runner's knee with Steve Carmichael from the Run Buzz podcast. And then the other episode that's really going to pertain to today's talk, it's episode 75 on what is causing my knee pain with Harrison Crum from Marathon Training for Beginners. That's going to be super helpful for you. And then checking out episode 102 that I did with one of our coaching clients, Christy. So Christy shared her story, how she went from having knee pain, went to all the doctors, went to all the PT that she was supposed to do, was told to stop running. And, we got together. She worked with us in our coaching program, and she was able to build up and actually crush her first marathon. So this was like super, super remarkable, her story. So I think that would be helpful for you if you are thinking that because of your knee pain, you can't be a runner, or running is bad for your knees, or you've been told to stop running, or your doctor just said, don't run until your knee pain goes away. You don't need to actually do all of that in order to actually still, get out there and get those mental clearing runs in. So make sure you check out the rest of this episode, and check out those previous trainings that we've done, because I think they're going to be super helpful for you. So I am actually going to, as I am talking about these, drop these into our Healthy Runner Facebook group. And for those of you who aren't on Facebook group, or not in our Facebook community, if you're on Facebook and or you want to create a fake account, or so people don't know it's you, but you really want to get a lot of really good running tips from our whole coaching team. On a daily basis, we are posting running tips that is really helpful for your running, whether it's performance related or health related. So there's some bonus content that isn't on the podcast in there, that's not on our YouTube channel. So you might want to join that, and join the other, honestly, 3,000 other runners who are just like you, looking to continue to run and, learn how to do it. We're not all experts in everything. So if you come to the Healthy Runner Facebook group, that's where you'll get all of your questions answered, and have one of our coaches on our team kind of reach out to you and answer your questions, as well as the other like-minded folks in our community. All right, so let's get into today's topic. We're talking 5 mistakes you're making to get rid of your knee pain. The first mistake that you're making to get rid of your knee pain is going to be icing. Yes, I said it. Stop icing your knee. Stop putting the cold pack. Stop putting the frozen peas on your knee after your runs, or even before your runs, to maybe mask the pain before you go out for a run. And the reason why I'm going to say stop icing your knee is really because of the anatomy and what is causing your knee pain. So there's really 2 primary causes of knee pain in runners. The first and the most common is going to be what we call runner's knee, which is literally tracking issues with your kneecap. So for those watching the video version, I'm going to point out some structures on my knee model here. So we have your knee joint, right? So this is a hinge joint. You have your femur bone, you have your tibia bone, your shin bone. And on top of that, we have this floating patella, right? That's our kneecap. So the floating patella, what causes runner's knee or knee pain in runners on the front part of your knee, is the cartilage on the under surface of that patella. So under it, if I took this kneecap right here and flipped it over, there's a lining of cartilage, and that's to protect the bone, right? If that cartilage gets irritated due to tracking issues with the kneecap on the femur bone, then that can create pain. And that's what kind of creates that soreness, that achiness on the front of your knee. You cannot point to it specifically. It just feels like pain on the front of your knee. That's what I'm talking about. That is what we call runner's knee or patellofemoral pain syndrome. Now, one thing to kind of clear right away is that it is not necessarily just a problem at the kneecap. And all of our treatments for this do not only address the kneecap. It has been shown now through research, and we have enough evidence to suggest that it is what's going on above the kneecap, so up here at the hip area, or what's going on below the kneecap, down at the foot and ankle. So we call those the proximal or distal influences to what is causing your knee pain. So that's what we know, and that is going to help you when we think about treating. Now, the reason I say to stop icing is because, number one, this problem is deep in your knee. It's an irritation of the cartilage underneath the knee, underneath the kneecap itself. And if your ice can even penetrate that low, it's probably not going to do a whole lot. What ice is going to do here is just mask pain. So it can function from an analgesic perspective, and be able to make you feel a little better. It's not going to treat anything whatsoever. It's not going to help this condition. If you have an inflammatory condition, there is some evidence that ice may help. And there's also some recent evidence to suggest that it may not even help. So let me show you some graphics. This is actually coming. I'm doing a little screen share right now for those listening on the podcast. So if you are not listening, if you're not watching the video version and I'm pointing stuff out, now you know that I'm pointing stuff out on this PDF here, this document. So this is our guide to crushing the miles without knee pain there. So let me just show you kind of some graphics here, which can clarify things a little bit better than what my kind of bone model just did. Here is showing the articular cartilage that surrounds the femur bone, and then there's the kneecap underneath. Here are the structures. The soft tissue structures around here are your quads and the quad tendon, and then that connects to your patellar tendon. So the patellar tendon, and this is all one kind of continuous structure. Your quads control that. So the quads are going to play somewhat of an influence on tracking of this kneecap, but it is going to be more your hip muscles up top here that control what your femur bone does. And how we think about this as an analogy, your kneecap on your femur bone is almost like a train on a track. And it's not necessarily that the train is always off the track. A lot of times it's the alignment of that track or the femur bone that is the problem or the root cause of why your knee hurts. All right. So it is a matter of getting to that root cause as opposed to masking symptoms, trying to decrease some inflammation that honestly is probably too deep for your ice pack to even get to in the first place. So that's the first thing I'm going to talk to you about is just really stop icing your knee. I talked about some of the alignment, and this is a nice little visual here, this picture of kind of your kneecap, quote unquote, out of alignment, and then ideal alignment of your kneecap. So that's just giving you a little visual on what it really would look like and how it irritates the cartilage underneath your kneecap. Now, symptom-wise, I kind of mentioned that before. This is going to be pain that is in front of your knee, and achy pain increases when you go up and down stairs with squatting, getting up from a low surface. If you sit too long, running, especially up hills, you might feel cracking, popping in your knee. That is the main cause of everything that we kind of talked about. Some other potential diagnoses are patellar tendonitis. So you can have an issue with the soft tissue, the patellar tendon, but that is going to be more pinpoint specific. Usually you can take your index finger, point to this area right on the front of your knee and say, this is where it hurts. That's usually going to be a classic sign of patellar tendonitis. Now, treatment wise, I outline all of the treatments here in this document here. So if you want that, PDF, like I said, just type in download. If you're listening to this on the podcast, I will drop the link in the show notes. So make sure you check out the show notes, grab your link, grab your, free guide. But the second mistake that I want to mention is bracing. I see this a lot. You get knee pain. You're like, all right, my knee's hurting. Let me grab one of those braces from CVS, Walgreens. And you're like, all right, I got to get my run in. Let me put this brace on, see if it feels better. Now, the brace is really not going to help you unless you are very young. You're maybe a teenager, maybe you're in your young 20s, and you have what we call patellar instability, meaning your kneecap moves all over the place. So it's moving around way too much. Then a knee brace might feel good because it's stabilizing your kneecap a little bit. I have used these clinically in certain instances, in only if I need to, meaning if we try exercises to actually strengthen the muscles around your knee and you still have pain, then we may utilize a brace. Like I said, this is very rare. And most of you listening to this, especially if you're like me in your middle age, you're in your 40s or 50s, you will not need that at all. So ditching the brace is going to be super helpful for you. Most clients that I've seen who use a brace, once we get rid of the brace, their pain actually decreases. And the reason for that is because now you're taking an external source and trying to control the kneecap, so that train on the track. And like I mentioned before, most of the time it is a problem with the track. So you're not really getting down to the root cause of why this person or why you are experiencing your knee pain. So stop bracing. Bracing will not help you. That is also supported within our clinical practice guidelines. So 2 years ago now, the Orthopedic Sports Association within our rehab field issued a clinical practice guideline kind of synthesizing all of the research that has been shown to help runner's knee in research, and bracing has been consistently shown to not help in the long term whatsoever. So ditch the brace. That's probably the second mistake that you're making. Third mistake is going to be taping. So taping was very, very popular probably 10, 15 years ago. I think it's definitely becoming less popular now. And it became popular because of the Olympics, right? We all saw, the beach volleyball players with tape on them, the kinesio tape. And what we found now, there's actually been a lot of research that has been done on kinesio tape. The biggest thing that taping helps is it reduces pain because we have a stimulus on our skin and it feels, and if you think it's going to work and it feels something on your skin, you're going to be like, I have less pain. However, we know that the direction that we tape, specific techniques are not going to really help, and they're really going to provide perhaps a little short-term relief of pain. I have utilized taping in the past, but again, it's been super rare where I actually need to tape a runner now who has this condition that we're talking about of runner's knee. And it would only be in the instance of I tried the exercises and the treatment that has been shown to actually help this condition, but symptoms are preventing us from doing it. So if symptoms are preventing you from doing your rehab specific exercises, then that is the instance in when you should tape. All right. So kinesio tape is not going to actually get this better. Again, it's only going to make you feel less pain, but it's not going to get down to the root cause of why you have this to begin with. Because as I mentioned, it is going to be those factors up at the hip or down below at the foot and an ankle. So the fourth mistake that you're probably making to get rid of your knee pain is that you're probably getting new running shoes. You might be changing your heel drop. You might be getting a different brand of shoes. You might be saying, you know what, this stack height, I'm going to increase. I'm going to try those Hokas that have a higher stack height. So these are all the variables that you can switch in your running shoes. But I'm going to tell you right now that running shoes will not change the knee pain that you have. And I know this is a common misconception within runners because we've actually studied this in our research as well, in our surveys, and show that the majority of you actually feel that your running shoes are contributing to your pain. And this has not been supported in the literature whatsoever. And anecdotally, I can tell you that all the runners that I work with and help with this condition all have different shoe brands, all have different stack heights, all have different heel drops. So there is no right running shoe that is going to help you get over your runner's knee. The biggest thing that we see for people who have runner's knee is the common running error, and the most common thing that I see when I analyze my clients on their gait videos and their running form videos is overstriding. And if you are overstriding, meaning when you are kicking your foot out in front of you, you're putting out that heel far out in front of your body, in front of the knee, that is landing on the ground first before your knee actually goes over your foot. So proper running form, when your foot hits the ground, your knee should be over that ankle. So it's lined over. So if you can drop a vertical down from your knee, it should land through your ankle joint. And this is the most common running error that we see, especially in novice runners. So if you just started out running within the last year or two, you're still a novice. And it takes a while for us to actually improve our running form to get more economical, to get more efficient in our running. So this is something that we can change with some gait retraining. And that is something that I get my clients to take shorter, quicker steps. And that's something that we can cue, possibly landing more on your midfoot versus your heel. Now, let me just say this is heel striking versus midfoot striking has not been shown any difference in terms of the number of running related injuries, but we do know that it does change forces. So if you're looking for some short-term gains and getting rid of your knee pain, we can work on changing your running form to more of a midfoot strike pattern as opposed to a heel strike pattern. And this will transfer more weight to your foot and ankle, which can be a good thing for your knee. However, if you're not properly trained, if you're not properly strengthened in your foot and ankle, can possibly create some issues down at your foot and ankle, such as plantar fasciitis, Achilles pain, posterior tib pain. So some of the common kind of foot and ankle injuries we see in runners. So just keep that in mind. There is a risk of that happening, and you might be trading one injury for another. So that's why it is recommended to make that type of transition slowly. Don't make any drastic changes in your heel drop and go from like a traditional 10 or 12 millimeter heel drop shoe to a zero drop ultra shoe, because that's when we tend to see this sudden onset of foot and ankle injuries in runners. So that is something that can be helpful, as opposed to just saying, hey, I'm going to get new running shoes, or I'm going to try the New Balance, or I'm going to try Saucony, and think that's going to help your knee pain. If it is a function that your mileage is long after the shoe, recommended mileage of 300 to 400 miles per running shoe, then yes, changing, and getting your new shoes may be beneficial in decreasing some of your symptoms. And then the fifth mistake, the most common that I do see, is that thinking that, hey, your knee hurts, it's because I don't do enough flexibility training. I don't do enough stretching. I'm too tight as a runner. I don't stretch my hamstrings. That's something I hear a lot. And this is something that will not help your knee pain whatsoever. The things that will get this condition better are strengthening the muscles in and around the kneecap, mainly the quads, and the muscles that control that track that we talked about, the femur bone, which are your hip muscles. That is the most important thing that is going to give you the most bang for your buck, and is actually going to get this condition to go away. The only thing that perhaps you may consider stretching is if your quads are super tight. So if you really have tight quads, then there is a way to actually stretch your quads without getting knee pain. And if you've been one of those runners who has this condition and you grab your ankle and say, okay, I'm going to do my quad stretch after my runs because I know I'm supposed to stretch after my run, and your knee hurts, then you'll definitely want to check out the video on how to stretch your quads on my YouTube channel. If you're watching the replay of this video, just type in quad stretch into the comment box. I will shoot you that video on how to properly stretch your quads to actually get a muscle stretch at where this muscle crosses your hip joint, and not have knee pain when you do it. So there's a better way than just grabbing your ankle, and it really relies on you propping your foot up on an object behind you, such as a chair, a sofa, the side of the treadmill, and you can actually stretch this structure better and not have knee pain while you are doing it. So if you type that in, I'll shoot you that video on how to do that. The other, structure that we talk about, and this is what I actually studied in my dissertation, is iliotibial band length. And can you stretch the IT band, or can you stretch the TFL muscle that's connected to it? I will tell you that you really can't stretch it. Is there a stretch? Can you Google a stretch, IT band stretch? Yes, you might have heard of it. It's when you kind of side bend over, you're standing, you're getting in, for those like who have dance background, you're getting in this ballet fifth position. You're side bending, reaching over. I've tried this stretch many, many years. I've tried it with many, many people. It's rare that anyone ever feels a stretch there. And truthfully, and looking at all the literature and the structure of the IT band and how fibrous it is of a connective tissue structure, you really can't stretch it, honestly. It's not a muscle. The muscle is a small muscle up at the top of your hip. So I find the most benefit is rolling the IT band to actually improve the extensibility. So I'm going to say the extensibility of the IT band and not the length of the IT band. And if it's more extensible, then it won't pull on the kneecap as much. And that is only if your IT band is super tight to begin with, right? So if that is you, then foam rolling it. And I have a great video of this on kind of the top 5 muscles to foam roll and how to do that properly, where you actually don't, if you've ever tried to foam roll your IT band and it's like killing you and you're like writhing in pain, you're like, this is torture. Like, how do people do this? I'm never doing this ever again. And you just give up, then make sure you check out the video on my YouTube channel of how to actually release the fibers in the front, slightly in front of the IT band, slightly behind the IT band to cause a decompressive effect to the band itself. So check out that video. Found a lot of success with that personally, and I've shared that with many of my clients and they enjoy it as well. And it's not as painful and it can actually have a benefit. So just to kind of recap here, guys, 5 mistakes that you're making to get rid of your knee pain. The first is icing it. The second is bracing it. The third is taping it. The fourth is buying new running shoes, thinking that's going to get rid of your pain. The fifth is stretching. These are the most common things I see on a day in and day out basis. So again, if you want to learn how to actually prevent runner's knee, how to prevent knee pain in runners, go ahead and grab your copy of the Ultimate Guide to Crushing Your Miles without knee pain. Just comment, download again. And for those watching the video version, let me do a quick little screen share again, because I do want to show you all that's in here. As we go down, I get into the specific treatments. I have the exact videos of the exercise I actually give my clients of how to actually isolate the quad muscle without having knee pain. So if you've tried like the quad machine in the gym and you're kicking the machine up and you're like, this is painful for my knee, I'm not going to do it. There is a way you can strengthen your quads without it being painful. The hip strengthening exercises that I mentioned before, clamshells, but we have to progress to standing. When we run, we're standing on one leg. You can't only do clamshells lying on a table. If you've ever been to PT and, you've just been thrown in a corner and an aid's taking you through, 15 feels like 15 exercise, or you're doing exercise for like 15 minutes on a table, and then maybe you ride the bike, and then maybe they slap some e-stim or an ice pack or a hot pack on your knee. That is not going to actually get you back to running. That may make you feel better in the short term, but when you start increasing those miles again, or you start running faster, you start training for a half marathon, you start training for a marathon, your pain's going to come back because you haven't addressed the root cause of the problem and you haven't trained those muscles to actually function like it does when you run. So there's a little kind of thing about taping here. And then I get into prevention. So kind of getting into what are the exercises that are going to help prevent it. And then really getting into the blueprint, right? So the Spark blueprint is really that 5 tips to run stronger and faster and enjoy lifelong injury-free running. A lot of those principles in the blueprint, a lot of the exercise we talk about in the blueprint are actually going to help your runner's knee. This is one of the conditions that it's very rare, honestly, that you need a lot of hands-on treatment, what we call manual therapy. And I'll be the first to tell you that. This is one of those conditions that does get better with the specific exercises. So if you are someone who's struggling with this condition and you haven't found the answers yet, Google has not helped you. Your local PT hasn't helped you. They don't understand that you're a runner. They don't understand that you need to actually run for your mental health, and you just can't stop for 4 to 6 weeks. And I'm here to tell you, you don't need to stop running whatsoever for this condition. I seriously don't think I've ever had a runner who has runner's knee or patellofemoral pain that I actually shut them down ever. Maybe I brought back their mileage a little bit, but once you actually get down to the root cause and you address it, you can actually stay running and actually get out of pain. So if that is something that you want to do. You're busy. You don't have time to go to PT like 3 times a week, like your doctor's telling you, and you actually want to get the clarity and focus you need to kind of get back to running without pain. That's exactly what we do in our Healthy Runner Spark Back coaching program, where I am your running physio and running coach all in one. And it really starts with us doing a run body performance assessment. So I'm going to look at your running mechanics, because I alluded to one error that we talked about before is kind of overstriding. I'm going to analyze that. I'm going to look at your running form. I'm going to look at your movement patterns and see, how are you squatting? Can you stand on one leg? Can you do a single leg squat, right? How is your ankle mobility? We're going to look at how strong you are, your flexibility, and then really look at your current like training points, because most times it isn't the physical elements that people get this condition, but it's usually training errors. And it's, either ramping up mileage too fast, running your easy runs too fast. So like, these are all things that we talk about, we analyze. And in this program, I really take you through 4 distinct phases. Phase 1 is we're going to restore your normal movement patterns. So you're actually, moving and your body's functioning like a human again. And you'll be surprised that our bodies get out of whack, whether or not it is stress related, injury related, pain related. Like I was away at a conference 2 weeks ago, and all of the sitting I did, being in a plane for a long period of time, right? Things happen, or things shift. Our body gets out of whack. We get like different muscles that get guarded. And sometimes we just need to restore. And that's what we do in phase 1. Phase 2, we rebuild your body, the capacity again to actually run. And so you're stronger for running. Phase 3 is really the retraining phase, where we really retrain your body to be a better, more efficient runner so it doesn't break down again. And then phase 4, we get you to crush it. So level performance. So whether it is a race that you have on your calendar, whether or not you're training for a half marathon, whether you're training for a full marathon, that's really what we get you to doing. And that might even be hard, thinking that you have this knee pain right now. And if you're saying to yourself like, oh, that sounds too good to be true, like, don't just take it from me. Like, hear from our clients who have been through our Healthy Runner coaching program before. Check out episode 102. We did a deep dive interview with Christy, one of our coaching clients who went through. She was told to stop running. She, got the MRI. She was told that, hey, there's probably, or the MRI in her case was clean. But I see many clients that get an X-ray and say, oh, you have beginning stages of arthritis, and maybe you shouldn't run, or maybe you need to take it easy with running, or maybe you shouldn't be a runner. So these are common things that our clients are told before they start working with us, and then they go on to actually get stronger, feel confident again, and be able to crush a first marathon like Christy did in her case. So check out Christy's story. I think that would be super powerful and just inspiring to know that there are answers, and there is a way that you can actually stay doing the thing you love, which is running, and continue pounding the pavement. So if you want to learn more about what it would look like for us to work together, and even to see if you're a good fit, honestly, because I want to make sure that you're a good fit for our program. And, let's jump on a strategy call. This is a low pressure call. I'll really ask you questions and see if you are a good fit. And if I can help you, then I'll let you know what it would look like for us to work together. If I can't, I'm going to point you in the right direction. I'm going to give you the best recommendations you need. Whether it is referring you to a local, clinician. I've done that before. Giving people a specific exercise, they're like, hey, you need to do these first before you're even ready. Or, if it's really not a good fit for you. But what we provide you is one-on-one clarity, focus, support, accountability, to get the answers you need to do and get rid of this knee pain and continue running. So keep you running the whole time, where you don't have to stop running. So if you're interested in learning more, head to programs.sparkyourtraining.com and learn more about our program right there. If you are, have questions, reach out to me, send me a message. I'll be happy to answer them. Shoot me a direct email, Duane, Duane @sparkyourtraining.com, and I will answer that for you. this has been great. Hopefully, I know this was a quick one, but I just wanted to share these 5 tips for you because I keep getting these a lot. And I hear this a lot from runners out there. So I really needed to share these misconceptions, these 5 mistakes. And I hope you learned something from this. If you did, let me know what new information you learned from this episode. And if it was helpful for you and you think this is helpful to help someone else that you know in your running community, do me a favor, just copy the link, whether you're watching on YouTube or you're listening on the podcast, just like hit that share, copy link, shoot it to them in a text, email, put it on your social media, just so we can get this information out in front of more runners and be able to help them doing what we love to do, and that is run. All right. Thank you so much for listening to this. I appreciate you guys. Remember, every week we go live within our Healthy Runner Facebook group doing live trainings just like this, not only on injuries. Most of our trainings are actually on nutrition, on performance, on how to, prepare for a race, how to recover from a race. So we have tons of trainings on the podcast, on our YouTube channel, on those topics. If you're looking for what's next, go to our Healthy Runner Facebook group and hit the events tab. You'll learn what we have coming up in the near future. And you can always join those live, join the conversation, get your questions answered. Thank you again, guys. Remember, as always, let's stay active, let's stay healthy, and let's just keep on running. Until next time, bye.